Hello everyone, my name is Andy and I'm a high school student from Sydney, Australia. My first question is whether countries have the duty or moral obligation to distribute medical resources, such as ventilators, that they themselves have domestically manufactured to other countries who are in need of them.
We have to set up an agreement among different countries so that people can have a rule to obey on certain levels. One, what are those resources each country have? Second, what are those resources each country want to share or have the ability to share? Three, what are those channels? So um, we would like to see a rule has been set up first so that people can know what are their options and they can make their decisions based on what's going on in everywhere. So what's happening now is we're not fully transparent to what's happening in other countries. And that is a very, um, I would say that's a wall between what we want from different countries and what they have. Sometimes the government and even like Massachusetts government can't get the accurate channel or source, and they need to dig that out themselves. And I don't think that's a very efficient way for doing that. And it will be more helpful to fix a problem if we have a rule set up and a list to share that people can ask and uh, put out what they want to share. It's okay if they don't want to share, but they need to, have everybody understand what's going on. And the adults will make their decision based on the rules and the clarity they have.
Where should that clarity come from? Is it the WHO that should be setting it up? Is it federal governments? Is there some other organizational body that could help coordinate that?
I think it should be an independent organization that is uh, apart from no matter which government country and which country government, so that they are not tied to whatever responsibility they feel they need to obey to their country, so that they will educate people and encourage people to do this as an NGO or on a nonprofit way, so that there's no way anyone can solely uh, get profit from doing this, so that people will treat it as an equal agreement to each one participating in this.
Hmm. So I don't want to put words in your mouth, but what I'm hearing is, so going back to the student's question, it sounds like national governments should be looking after their own populations first, and the place for more international generosity might be in the more non-governmental sector.
Yeah, I think you're right. It's the first step is to make plans for your own country and manage the things happening in your country. And the second is to work on collaboration, because sometimes you cannot fix your problem by yourself. You need some people's
Hmm.
help.
Hmm. And William, do you have anything to add?
Yeah, I think it's a really good question and a really, really important question and a really interesting question. And I think it all kind of comes down to how how much a part of the world, the rest of the world, and other countries feel like they are, versus how much a part of their region other countries feel like they are. And so like you both alluded to that, nationalism versus kind of a globalism mentality. And it's really interesting because um, this is the virus is affecting the whole world, and the virus is affecting everyone. and it doesn't matter where it started. The fact is, everyone's kind of in this now, and also importantly, I heard someone say the other day that that the virus won't be over anywhere until it's over everywhere. So there's no point in kind of having your own kind of country safe and clear if the rest of the country is still, if the rest of the world is still in chaos, because there are still going to be so many restrictions to your country that are a direct result of the rest of the world still being so heavily affected. So I really think that the mentality of we're all in this, and nowhere is going to be clear of the virus until everywhere is clear of the virus is really important. And it affects things like ventilators. It also affects things like vaccinations. So there's obviously a lot of different organisations and countries working on a vaccine at the moment. But there's this kind of concern that when a vaccine is developed, there'll only be a certain amount of vaccination developed, and who gets that first. And if you adopt the mentality that that the whole world is kind of affected and involved, then you could kind of figure out, okay, on a global scale, who are the most important people to give this vaccination to. So figuring out who gets access to these finite resources like ventilators or like vaccines first is important. But I think that it's I don't know what happens in the real world, but I think that this is a global problem, and we're all in this, and it's not going to be over anywhere until it's over everywhere.
Hi, my name is Sana, and I'm from Lahore, Pakistan. And my country has been in a government-induced lockdown since February 15th to help minimize the spread of COVID-19. Due to this lockdown, around 60% of Pakistan's population has been unemployed and starving. Therefore, my question to you is, how can the government and the general public better prepare for future outbreaks and pandemics?
It's really sad to hear about countries like Pakistan that have so much of their population affected. I'm really sorry. Two of the things that can be done that have worked this time have been international collaboration between teams, so teams working together and teams sharing information they have with each other. I think it was Yuval Harari who said once that the difference between humans and the virus is that the virus in China can't give tips to the virus in the US about how to best infect people. But people in China can give tips to people in the US about how best to stop people getting infected. So making sure we do that, we have a system to do that early next time, and making sure we do that well next time is going to be really important. So things like data sharing, so generating consistent, good data for when people are well and for when people are sick across all countries, that is shared between countries and can be used to create big bodies of information that have powerful, robust conclusions next time is going to help arrive at some sort of information or decision a bit quicker. And international collaboration, so people talking to scientists from all over the world talking to each other, sharing ideas, sharing findings, and teaming up to study together to arrive at conclusions earlier, and conclusions that are applicable to not just one population, but broad populations across the whole world. So I think those two things are going to be really important, or have been really important this time, and this is kind of a reminder of the importance to keep thorough databases even when things are good, and make sure we share those databases even when things are good, because when things get bad, and they will get bad again, we then already have this infrastructure in place, and this big data, this big collective database in place that we can use to figure out clear, consistent answers to problems faster.
Yeah, I think William's point on technology support is very great. I do agree with that. And I'm also very sorry to hear what's happening there. I think, ironically, in the COVID-19 pandemic, the most vulnerable people are the most likely to be hardest hit. So maintaining essential health service is vital to reduce additional deaths from COVID-19. And it was not the only case that we've seen with pandemic issues. We do see that problems also with chronic conditions like diabetes or something like that. The vulnerable people, the most vulnerable people are the most likely to be hardest hit. That problems is right in the fields of public health. And I think people in public health, some people tend to be the policymakers, and for the policymakers, they're facing a greater challenge today to make a multi-policy approach that adopt with multiple considerations like public health, economic resilience, and demographic risks, something like that. We cannot predict the health conditions in the future very well. So it's a little bit harsh to blame only on the policymakers, because there are some people who make the policies and some people decide what they want to obey. And I think the second key resolution to that will be to make sure that everyone understand the pandemic control relies on the community engagement and trust. So you have to first trust the people who tell you what to do, when to do, how to do, and then you need to actively engage in that to make sure your own safety. And if everybody can do that in a certain way that they feel comfortable with, I think there is a way to, fight this all together.